it's good to have the opportunity to discuss some cases and issues with you, because you are also using urodynamics a lot as a diagnostic tool, particularly in neurogenic patients. I got the feeling on conferences, and maybe you have the same impression, that urodynamic is a diagnostic tool that is often challenged by colleagues, particularly those that don't use it on a regular basis. However, I think it is that there is no doubt that it's a cornerstone and an absolutely necessary and important diagnostic tool, particularly in the neurogenic population, because it is relevant to decide, based on your dynamic findings, what is the treatment and what kind of risk group they belong to. How do you see it in your practice?
Well, I agree 100%, Ulrich. I think urodynamics are essential. And if there's one population where you really 100% need them, it's patients with neurologic diseases. So the bladder really doesn't give reliable symptoms in this patient population. For obvious reasons, in some, such as a spinal cord injury, there aren't sensory nerves hooked up to the bladder in the normal way. And there's just too many things that go on in these bladders that you can't differentiate based on symptoms. Differentiating between incontinence from poor compliance versus from neurogenic detrusor overactivity is impossible without doing urodynamics. Finding problems such as reflux into a kidney, you need video urodynamics to see when that's happening, to see if it is happening in a neurogenic bladder, to see what's causing it, whether it's happening passively or actively. I mean, there's so many examples there that you can look at where urodynamics really make a huge difference in how you're going to manage the patient. And especially for patients moving forward to more invasive treatment options, so non-sort of oral therapies, I really do think urodynamics offer an essential insight into the bladder physiology and pathology that you need to guide your treatment. A cardiologist isn't going to diagnose a patient with a heart attack without their EKG. I'm not going to diagnose and treat a neurogenic bladder without urodynamics in a lot of situations. So I think it's analogous, and I really do think it's a good tool that requires some expertise to use, but gives you some great information when it's used properly.
I see it the similar way, and also I think it's an effective diagnostic tool, because there are so many parameters that you can observe at the same time. As you said, it's the shape also. There's reflux. If you do the video, you can observe the dynamic of voiding, if that is still possible, and you measure the pressure and the interplay between the detrusor and the sphincter function. So you can have really a lot of information in one investigation.